Hello, YouTube. Um, I have a question. This question is directed towards doctors, nurses, PAs who work either in emergency room settings or work in the mental health care field. Um, in my experience with my girlfriend, now my wife, over the years, she does suffer from various mental illnesses and does go to the hospital from time to time. But in the instances I'm asking about, what do you do when a patient is ignored uh, and written off as crazy because of a mental illness? It's a fact that it happens. I've seen it even in a mental hospital. Um, Take, for instance, the situation that happened last night. My wife went to the hospital and she was, you know, taken to the emergency room because they have to go through there to be processed first or assessed. And basically, once they find out you're crazy, you kind of get shrugged off, and a lot of the times you're made to feel like you're making it up. Um, what can we as patients and the family of patients or friends of patients do to be taken more seriously instead of just pushed aside? Um, I know a lot of ER doctors are, strung out on stress and whatnot and have to deal with a lot of other things. But this is something that we just can't ignore. And a lot of places require you to go to the emergency room to be assessed before you're admitted for anything mental illness related. This also happens with, take for instance, when my wife hurt her back. We went to the hospital, and once the doctor went over the record or the medication list and sees what she takes, everything's kind of like, oh, just take a Benadryl or an Advil, you'll be fine. How do we get around that? What are some ways we can do that? And have you ever found a way to get around, as a worker in a hospital, getting around someone who doesn't necessarily want to take it as serious as they could or should? I'd be more than willing to listen to what you have to say, bad or good. Just information helps. Thank you for your time, and I hope to hear from you.